The commander was dying, and the last thing he did wasn't pray. He grabbed the chief surgeon by the collar, dragged him close, and whispered the words that would ruin careers and expose a lie big enough to kill, "Bring me the nurse you fired." Outside Rainier Armed Forces Medical Center in Tacoma, rain hammered the glass like a warning. Inside, a lockdown sealed every exit. Monitors screamed, boots thundered in the corridor, and the air smelled of antiseptic and panic. Dr. Nolan Mercer wanted a clean victory, a headline, a promotion. But the dying man on the table didn't trust him. He trusted the voice he'd heard once in a war zone guiding him through blood and darkness. Stay with this story. By the end, you'll know what courage really costs. Like the video comment where you're watching from and tell me this, would you break protocol to save a life? The words still hung in the air like a verdict. Bring me the nurse you fired. And everyone in that room knew they had not just been spoken in desperation. They had been spoken with certainty. A dying man does not gamble with his last breath. 6 months earlier, Rainier Armed Forces Medical Center looked polished from the outside, all glass and clean angles, a place that promised safety to people who had spent their lives in chaos. Tacoma's winter rain slid down the windows in slow streams, turning the parking lot lights into blurred halos. Inside, the hospital smelled like disinfectant and burnt coffee, and the hallways carried a constant undercurrent of hurry, the kind of hurry that never quite caught up with itself. Trauma. Bay 4 was smaller than it should have been, cramped by equipment and policy. The walls were scuffed where gurneys had clipped corners. A supply cabinet with a glossy black keypad sat near the medication cart, new enough to still look expensive. A laminated sign taped above it read, "Controlled access. Physician authorization required." Nurse Erin McCall stood at the foot of a gurney, with her hands open, palms slightly lifted, as if she could steady the whole room by force of will. She wore the standard Navy scrubs, but she carried herself like she had been trained to move through explosions. Her hair was pulled tight. Her eyes never stopped working. They scanned the patient's chest, his lips the rise and fall of his abdomen, the numbers on the screen, the frantic hands of the new tech who kept tugging the blood pressure cuff as if it might behave if he bullied it. On the gurney was PFC Tyler Grant, 19 years old, freckles across his nose, a jawline that still looked like it belonged to a kid. His eyes were wide, wet with panic, and his hands clawed at his own throat. A rash spread across his neck and chest like a spill of angry paint. His breaths were turning shallow. Not fast, not slow, wrong. His airways closing charge, Nurse Linda Park said, voice tight. She had one hand on Tyler's shoulder and the other on the side rail, bracing him as his body trembled. Her badge swung with each movement. "Tyler, look at me. Stay with me." Tyler tried. The sound that came out of his throat was thin, high, and terrifying. A whistle that belonged to a place in the body that should never whistle. Erin leaned closer, watching his mouth. The swelling at his lips was subtle, but she saw it. Subtle was how people died when the room waited for obvious. Anaphylaxis, Erin said. Not a diagnosis spoken for drama, a simple word that cleared the fog. "We need epinephrine now." The tech looked toward the cabinet. "Dr. Mercer has the lock." Linda's eyes flicked to the hallway. "He's not here." Erin's gaze snapped to Linda. "Where is he?" Linda did not answer at first. She did not want to say it out loud because saying it made it real. "VIP lunch," she finally said. "Board and donors. He's on the top floor." A beat of silence passed. Not calm silence. The kind where everyone hears the same thing and knows it is wrong, but no one wants to be the first to move. Tyler's face was changing color. Not gray, not pale. The dull, bluish tint of oxygen leaving. Linda stepped to the cabinet, punched in her code anyway, then pressed her thumb to the sensor. The keypad chirped and flashed red. Access denied. Linda tried again, red. "Come on," she whispered, as if the machine could be convinced by desperation. "Come on." Erin stared at Tyler's throat as it tightened, watched his fingers scrape at his skin. watched his eyes plead for air, like air was a person who had betrayed him. "What's the policy again?" Aaron asked, voice low. Linda's mouth tightened. "No schedule medications, no paralytics, no emergency meds without an attending thumbprint." Mercer's rule. Aaron's jaw flexed. She remembered hospitals in Kandahar where the power went out daily, and people still lived because someone decided that a breathing human mattered more than paperwork. Linda's voice shook. "He said the next person who bypasses the lock is terminated. Immediate." Tyler made another sound, smaller this time, like his body was running out of ways to ask. Aaron turned her head, looking down the hall. The corridor lights hummed. A janitor's cart rolled by in the distance. Somewhere a phone rang twice and stopped. The hospital went on living its normal life while a teenager drowned on a gurney. Aaron reached for the crash cart. Linda grabbed her wrist. "Aaron, don't. You know what he'll do. He'll bury you." Aaron looked at Linda's hand on her arm, then up to Linda's eyes. Linda was not a coward. Linda was a survivor. Survivors learned the cost of being right in the wrong room. "If I do nothing, he dies," Aaron said. Her voice was steady, but her eyes burned. "If I break the lock, I lose my job. That's not a choice. That's a threat." Linda swallowed hard. "Aaron." Aaron pulled free, not harshly, just decisively. Her fingers closed around the red emergency hammer mounted to the cart. Heavy. Solid. Built for breaking rules and disasters. Tyler's eyes rolled for a second and his body jerked. Aaron's decision landed in her body like a click. The sound of a chambered round. No anger, no fear, just action. She swung. The glass cracked with a sharp pop and then exploded inward. The sound was louder than anyone expected. People flinched. The tech gasped. Linda shut her eyes for half a heartbeat like she was watching a car crash she could not stop. Aaron reached into the cabinet and grabbed the epinephrine, the intubation kit, the supplies she needed. Her hands moved with practiced speed, not frantic. The kind of speed that came from doing this when the lights were out and someone was screaming over a radio. "Tyler," she said, leaning close, voice firm, almost gentle. "Hear me. I'm going to help you breathe." Tyler's eyes found hers. He nodded once, barely. Aaron administered the medication, then positioned him jaw-thrust oxygen on suction, ready. She worked as if her hands belonged to someone else. Someone whose only job was keeping blood inside bodies and air inside lungs. Linda moved in beside her without speaking. The tech snapped into motion, finally understanding what the room required. Someone held Tyler's shoulders. Someone passed Aaron the tube. Someone called out vitals with a shaky voice that steadied as the numbers began to change. Aaron slid the tube past swollen tissue with precision that looked almost unreal if you had never seen competence in an emergency. Tyler gagged, then his body fought, then gave in as the airway opened. The monitor shifted. Oxygen climbed. Color returned to his cheeks in small increments like life was walking back into him, carefully suspicious of being tricked. Tyler's chest rose under the rhythm of controlled breaths. He was alive. The room exhaled as one. Linda let her head drop for a second, relief hitting her like dizziness. The tech wiped sweat from his forehead with the back of his wrist. The new nurse at the doorway stared with wide eyes as if she had just watched a magic trick and realized it was only skill. Then the double doors swung open. Dr. Nolan Mercer walked in as if he owned the air. Tall, perfect posture, clean white coat. A man who never seemed to sweat even when others bled. He carried the faint smell of expensive cologne that did not belong in a trauma bay. Behind him were two administrators, both in tailored suits that made the medical staff look like workers in a factory. Mercer's eyes went straight to the shattered cabinet. He stopped so fast the administrators nearly bumped into him. What Mercer said softly. The word was quiet, but it landed with weight. He took 2 steps forward, and now the room felt smaller. Not because of his size, because of his authority. Aaron met his gaze without flinching. Her heart was pounding, but her face did not show it. She had seen men with more weapons than Mercer. She had seen men with less humanity. patient had an anaphylactic reaction to contrast dye, Aaron said. You did not respond to pages. His airway was closing. I administered epinephrine and intubated. Mercer looked at Tyler for the first time. A quick glance, alive, breathing, a success. He did not praise her. He did not even ask how close Tyler had been to dying. His attention snapped back to the broken lock, the glass shards, the exposed hardware. You broke protocol? Mercer said louder now for the administrators. You destroyed hospital property and administered restricted medication without physician oversight. That is gross negligence. Linda inhaled sharply. The tech looked down at his shoes. Aaron's voice rose not in volume but in steel. That is saving a life, she said. She gestured toward Tyler's steady monitor. He is breathing because I did not wait for you to finish your lunch. The air went cold. Not temperature tension. One of the administrators shifted his weight uncomfortably. The other lifted his chin like he was watching a courtroom. Mercer's mouth tightened. His pride had been struck in front of witnesses. He turned slightly, positioning himself so the administrators could see his profile, his composure, his control. He was performing. This, Mercer said, is exactly what I have been warning the board about. The nursing staff believes it can override chain of command. That is a liability. If she had missed the dosage, if she had made an error, we would be dealing with a lawsuit. I didn't miss, Aaron said. Mercer's eyes flicked to her a brief flash of irritation. He was not used to being contradicted, especially not by someone without an MD stitched to their chest. You are done, he said, voice flat. Pack your locker. I want you off premises in 20 minutes. Security will escort you. Linda stepped forward. Doctor, she is the senior trauma nurse on shift. We are short-staffed. We need her. Mercer's gaze did not soften. It sharpened. Not anymore, he said. He looked at the administrators as if asking for confirmation. Make sure this goes on her permanent record as a safety violation. Flag her license for review. We do not allow cowboys in my hospital. The word cowboy hung there. Insult disguised as policy. A way to frame courage as recklessness. Aaron felt heat rise behind her eyes, but she did not let it become tears. She looked at Tyler now asleep, breathing through the tube, his chest rising steadily. Alive because she had been willing to be hated. Then she looked back at Mercer. For a second she saw what he really was. Not a healer. A man who wanted to win. Aaron reached up and unpinned her badge. The plastic clip snapped open with a small sound that somehow felt louder than the cabinet breaking. She placed it on the metal tray beside Tyler's bed. It clattered softly. You're a small man, Nolan, she said quietly. One day someone will come through these doors that your ego cannot save. Mercer's face hardened, but he did not reply. He did not need to. He had the power to end her. 2 security guards appeared at the doorway, summoned as if they had been waiting behind the wall the whole time. One of them, a young man with kind eyes, looked at Aaron like he wanted to apologize without speaking. Aaron picked up a cardboard box someone had brought from the supply closet as if her life could be packed like office supplies. She moved with calm that came from refusing to beg. She walked out of Trauma Bay 4 with her shoulders straight. Behind her, the hospital swallowed the sound of its own hypocrisy and kept humming. In the hallway, the fluorescent lights made everything look pale. Nurses stood clustered near the station, pretending to chart, pretending not to look. Some eyes followed Aaron with sympathy. Some with fear. Fear that if they moved, they would be next. Aaron stepped into the locker room and opened her locker. A small photo taped inside stared back at her. A man in uniform smiling, arm around her shoulder. Her husband gone now. Killed by an accident that did not make headlines. The kind of death that only matters to the people who loved you. Aaron took the photo down carefully. She wrapped it in a folded pair of scrubs. Next came her stethoscope, worn at the edges. A few pens. A folded letter from a patient's mother that said "thank you" in messy handwriting. A challenge coin from a unit she had once saved during a convoy ambush. She put the coin in her pocket without thinking. Habit, a talisman. Linda pushed the locker room door open, face tight with anger and grief. "I tried," Linda said. Aaron nodded once. "I know." Linda's voice broke. "He's going to ruin you." Aaron held her gaze. "He can try." Linda stepped closer, lowering her voice. "They're already talking about a report to the state board. He's got the administrators writing it up right now." Aaron's stomach tightened. It was one thing to lose a job. It was another to have your license threatened. Without that license, you were not a nurse. You were a person with memories and no way to use them. Aaron closed her locker, the metal door shutting with a hollow sound. "I saved that kid," she said, not asking, stating. Linda's eyes shone. "I know, I saw." They stood there for a moment, two women in scrubs, surrounded by tile and fluorescent buzz, knowing the system did not reward the right thing. It punished the inconvenient thing. Aaron walked out through the staff entrance, security a step behind her like she was dangerous. The rain hit her face the moment she pushed open the door. Cold. Sharp. Tacoma rain that did not fall so much as press. The parking lot smelled of wet asphalt and exhaust. Her car sat under a streetlight with beads of water glistening on the hood like sweat. She put the box on the passenger seat and sat behind the wheel for a long minute without turning the key. Her hands were steady on the steering wheel. That was what scared her. She had been steady in war zones. She had been steady while people screamed. Now she was steady while her life was being dismantled, and she did not know whether that meant she was strong or simply numb. She drove home through streets slick with rain and reflected lights. Tacoma's city glow blurred at the edges as if the world had lost focus. She passed bars, gas stations, a closed diner with a neon sign buzzing weakly. Ordinary life. People laughing inside warm buildings. No one knowing that a nurse had just been erased for refusing to let a teenager die. Her apartment was small, clean, quiet. The silence inside was heavier than the rain. Aaron set the box down and stared at it like it might contain something explosive. She hung her coat, then sat at the kitchen table. She pulled out the photo of her husband and set it upright near her coffee mug. The clock ticked. A neighbor's television murmured through the wall. The sound made her feel strangely alone. Her phone buzzed. A message from the hospital's HR portal, mandatory meeting scheduled. Subject termination procedure. Aaron stared at the screen until it dimmed. Then another buzz. A voicemail notification. Unknown number. She listened. A crisp, rehearsed voice. "This is a notification that a complaint has been submitted regarding a medication access violation. Further review may involve referral to the Washington State Nursing Commission." Aaron's throat tightened. Not fear. Rage. The kind of rage that was quiet because loud rage wasted energy. She set the phone down carefully like it might shatter. The next morning, she showed up at the HR office anyway. She wore a plain sweater, hair still pulled back. She looked like someone attending a funeral because she was. The HR representative did not look her in the eye for long. He spoke in soft, apologetic tones that never changed the outcome. "This is complicated," he said. "Dr. Mercer has documented concerns." Aaron leaned forward slightly. "Documented what?" "That I kept a patient alive." The representative swallowed. "It is about process. It is about power," Aaron said. He flinched but did not deny it. She left with paperwork and a final paycheck that felt insulting in its smallness. Then came the refusals. She applied to another hospital in Tacoma. Rejected. A clinic in Olympia. Rejected. A travel nurse agency that had once begged her to take contracts. Silence. She called a former colleague in Seattle, a supervisor who owed her favors. The woman's voice was low. "Aaron, I can't. They said you're flagged. They said liability." Aaron stared out her window at the rain. "I've been shot at," she said softly. "But this is the part that makes me feel helpless." By the third week, her savings began to look thin. By the sixth week, she sold her second car, the one her husband had loved because it sat unused, and she could not afford sentimental objects. By the second month, she stopped telling friends she was fine. At night, she lay in bed and heard phantom alarms in her head. The beep of a monitor dipping. The hiss of oxygen. the wet sound of someone struggling for air. She would wake with her heart racing and sit up listening to silence. Her hands stayed steady. Her life did not. Meanwhile, Rainier AFMC kept moving, because institutions always do. It replaced her with someone who would not break glass, someone who would not argue, someone who would smile at administrators and chart perfectly while patients waited. In the third month, Aaron ran into Linda outside a grocery store. Linda looked thinner, tired. They stood under the awning while rain hammered the pavement. "How is it?" Aaron asked. Linda hesitated. "Different." "Better," Aaron said, though it did not sound like a question. Linda's mouth twitched, not quite a smile. Quieter. People don't argue with Mercer. People don't do anything without checking 3 times. The new head nurse, Brittany Sloan, she's all spreadsheets and policy binders. She doesn't like improvisation. Aaron nodded slowly. Improvisation is what you call it when you do not want to say judgment. Linda glanced around, then leaned closer. "They installed more locks," she whispered. "More approvals. More oversight. Mercer tells the board it reduced costs. Donors love him." Aaron looked past Linda at the wet streetcars cutting through puddles, and the patients. Linda's eyes dropped. Some of the good nurses quit. Aaron exhaled through her nose, not surprised, just tired. Linda touched Aaron's arm briefly. "You should fight it," she said. "Appeal to the board. Go public." Aaron's gaze sharpened. "And watch them call me a disgruntled employee." Linda had no answer. They stood there a moment, the rain a constant, the world moving around them, both of them knowing that truth did not always win it, just waited for leverage. Aaron found work where no one asked for references. A place where the patients could not file complaints and the administrators did not care about titles. Paws and pints animal. Emergency was open all night, tucked beside a closed bowling alley, its sign flickering with one dead letter. Inside, the air smelled of bleach and wet fur. Dogs barked behind doors. Cats hissed from carriers like tiny demons. The first night Aaron walked in, the receptionist looked at her resume, blinked, and said, "You sure you want this?" Aaron nodded. "I need work." The receptionist slid a name tag across the counter. Aaron McCall, technician. Technician. A word that felt like being demoted by the universe. Aaron took it anyway. She cleaned kennels. She held trembling animals for injections. She comforted owners whose faces looked exactly like the faces of families Aaron had met in military wards, faces that carried the same helpless love. Sometimes an animal would crash, and Aaron's body would wake up fully, hands moving with that same precision, the same calm. She would stabilize, intubate if needed under the vet's direction, start lines, manage oxygen. And afterward, when the animal survived, she would feel a familiar relief, followed by the quiet sting of knowing she was doing this in a building that smelled like dog shampoo instead of sterile surgical prep. The work did not care about her medals. The animals did not care about her history. The animals just needed someone who refused to quit. Still, at 2 a.m, when the clinic lights hummed and the world outside went silent under rain, Aaron would pause with a sponge in her hand and stare at nothing for a second. Her mind would drift to Trauma Bay 4, to Tyler's blue lips, to Mercer's clean coat, to the sound of glass breaking, the sound that had changed everything. She tried not to think about Tyler. She had no way of knowing how he was doing. No updates, no permission to check. Sometimes she imagined him walking out of the hospital weeks later, alive, laughing with his friends, never knowing the cost of his survival. That thought was supposed to comfort her. Sometimes it did. On a Thursday night, about 5 months after the firing, Aaron was scrubbing the kennel floor when a TV in the waiting room played a news segment. The sound was low, mostly ignored, but a phrase caught her ear. Defense contracts, oversight, fraud investigation. A commentator's voice mentioned shell companies and questionable donors tied to medical grants. Aaron stopped scrubbing. She listened for a moment, heart thudding, then shook her head and went back to work. The world was full of corruption. It always had been. She had learned that in uniform. She had learned it in hospitals. She had learned it in the way money moved like water, finding every crack. Her phone stayed mostly silent these days. Friends stopped calling when they did not know what to say. Employers stopped replying when her applications hit whatever invisible wall Mercer had built around her name. Then late one night, Linda texted a single line. "Miss you, be careful." Aaron stared at the message thumb hovering over the screen. She wanted to ask why. She wanted to ask what Linda knew. She wanted to ask if the hospital was safe. Instead, she wrote back, "You too," because that was what survivors did. They kept sentences small when fear was large. The rain kept falling in Tacoma night after night, turning streets into mirrors and making the city feel like it was drowning in its own reflection. Erin started to believe that her life might stay this way. Not forever. Nothing was forever. But long enough to change who she was. On the 6th month at Paws and Pints, she worked the graveyard shift alone with a young vet who still called her ma'am out of nervous respect. Erin's hands were raw from bleach. Her shoulders ached. Her hair smelled faintly of disinfectant no matter how many showers she took. She was on her knees scrubbing dried paw prints off tile when she heard something outside that did not belong. Not a siren, not traffic, a low, heavy thump that vibrated through the glass. She paused, sponge dripping in her hand, and listened. Another thump deeper this time, followed by the distant chop of rotors somewhere across the city. The second thump rolled through the glass like distant thunder, and the clinic's waiting room lights trembled in their fixtures. Erin set the sponge down slowly. The sound was not traffic and it was not weather. It had weight, rhythm, intent. Outside, the night was a sheet of rain, and Tacoma's streetlights smeared into gold streaks across the wet pavement. Her phone vibrated in her pocket. Linda Park. Erin stared at the screen for a beat too long, as if the name itself might be a trap. Linda did not call during the night shift unless something had broken in a way that could not be fixed with a text. Erin answered, keeping her voice low. "Linda." Linda's reply came out too fast, too thin. "Erin, you have to come back." Erin leaned her shoulder against the cinder block wall. Cold seeped through her scrub top. "No." "Listen to me," Linda said. Erin could hear alarms in the background, the muffled pitch of a monitor, and the sharp bark of someone giving orders. "It's not Mercer." Erin let out a bitter laugh that did not reach her eyes. "It's always Mercer." "It's the military," Linda said, and her voice cracked on the word. "They brought in a patient under code black. They locked down the floor. MPS everywhere. Erin, he asked for you." Erin's jaw tightened. "That's not possible." A scuffle sounded on the line, the quick scrape of fabric, a hand covering the microphone. Then the phone shifted, and a new voice filled her ear, calm and heavy like a door closing. "Nurse McCall." Erin's spine stiffened. The man did not introduce himself with uncertainty. He spoke like someone used to being obeyed. "This is Command Sergeant Major Hank Dorsey," the voice said. "Security detail for Major General Mason Vale." Erin's fingers went numb around the phone. The name struck her like a flash of heat. For a second, she was not in a vet clinic. She was hearing radio static and wind, someone shouting coordinates the distant crack of gunfire. Dorsey continued, tone steady. "The general is in cardiac collapse. He has refused further care from Dr. Mercer. He requested you by name." Erin swallowed. "I can't go back to Rainier. Mercer had my license flagged. He threatened to have me arrested if I stepped on hospital property." "Dr. Mercer does not have a vote tonight," Dorsey said. "Step outside the clinic, ma'am." Erin's mouth went dry. "Where are you?" There was the faintest pause, not hesitation, calculation. "Your neighbor said you work nights. We are at your location now." Erin's pulse slammed against her ribs. She turned her head toward the front glass of the clinic. Headlights flooded the windows. Not one car. Two. Then a third. A tactical SUV slid to a stop half on the sidewalk, rain exploding outward from its tires. Blue and red lights flashed without sound, the kind of light meant to dominate, not to warn. Men in dark gear stepped out, moving with the smooth purpose of people trained to arrive when time is already gone. The young vet on duty looked up from a chart, startled. "Erin, what is that?" Erin did not answer. She could hear her own breathing shallow and tight. She looked down at her scrubs. Dog hair clung to the fabric. Bleach stains marked the knees where she had been scrubbing tile. She looked like someone who cleaned up messes, not someone who made life and death decisions. "I can't go in like this," she whispered mostly to herself. The clinic door chimed. Dorsey walked in like the building belonged to him. He was massive, shoulders filling the doorway. Water dripped from the brim of his cap. His eyes swept the room once, fast and sharp, then landed on Erin. He took in the tired posture, the stained scrubs, the raw hands. He did not look at her like a fallen employee. He looked at her like a medic who had been pulled off a battlefield too soon. "The general did not ask for a fashion show," Dorsey said. His voice was quiet, but it carried. He asked for the nurse who kept him alive before. Erin stared at him. "I have no privileges, no badge." Dorsey's expression did not change. "You have hands. You have a brain. You have his trust." He stepped slightly to the side, revealing 2 soldiers behind him, with a hard case and a rain-slick duffel. "We have a helicopter waiting at the stadium field 2 blocks away," Dorsey said. "Roads are too slow." The vet found his voice again, nervous and confused. "Excuse me, who are you people? This is an animal clinic." Dorsey glanced at him once, not unkind, simply uninterested. "Thank you for her service tonight. She is coming with us." Erin looked at the kennel hallway behind her, at the mop bucket, at the half-cleaned tile. A ridiculous detail to notice in a moment like this, but her mind grabbed onto the ordinary because the extraordinary was too large. She set the phone down on the counter and untied her apron. Her hands shook for the first time, not fear adrenaline waking up the old reflex that lived beneath the disappointment. Linda's voice returned faintly through the phone speaker where she had left it connected. "Erin, please." Erin picked it up again, held it close. "How bad is it?" Linda swallowed audibly. "They can't stabilize him. Mercer keeps throwing orders. Nothing is working. Caleb is in there. Everyone is in there." Erin closed her eyes for one breath. "Put me on speaker when I walk in," she said, then stopped herself. That was not how this would go. She was not going to talk through a door. She was going to be in the room where the air smelled like blood and the monitors did not lie. She ended the call and looked at Dorsey. "If I do this, I may not be able to come back here." Dorsey nodded once, understood. Erin grabbed her jacket from the hook and slipped her feet into waterproof shoes, then hesitated, hands hovering over the stethoscope hanging on the wall in the clinic's treatment room. It was not hers, but she touched the tubing lightly anyway, the way a person touches a familiar weapon before walking into danger. The ride to the field was a blur of rain and tight turns. The SUV smelled like wet nylon and engine heat. Erin sat in the back between 2 soldiers who did not speak. Their faces were young, but their eyes were not. A helicopter waited in the darkness, rotors already spinning the air around it, violent and alive. Rain whipped sideways in the rotor wash, stinging Erin's cheeks. A crew chief held the door open and motioned her forward. Inside, the noise swallowed thought. Erin, strapped-in headset pressed over her ears. The world outside became streaks of light and shadow as they lifted into the storm. Tacoma fell away beneath them. The city became a grid of blurred gold. Erin stared down at it and felt something strange. Not hope, not fear. Something like being called back into a life she had been forced to bury. Her mind drifted uninvited into memory. A different sky. Not rain dust. The horizon flat and harsh. A radio crackling with interference. She had been in a base clinic with sand in the seams of the floor tiles. Her hands were bloody, not from her own wounds but from someone else's. A voice had cut through the chaos on the line controlled, refusing to panic while men screamed in the background. "This is Mason Vale. We have shrapnel in the thigh. We are pinned. We need guidance. Now." Erin had responded without thinking. "Pressure dressing here. Tourniquet here if arterial. Do not pull the shrapnel. Keep him talking. Keep him breathing." The voice had listened. The voice had trusted her. They had never met, but that night her words had been the difference between a man bleeding out in the dirt and a man walking again. Erin opened her eyes as the helicopter banked the city lights, turning. She pressed her fingertips together, a habit grounding herself in the feel of her own skin. Dorsey leaned in close, his voice crackling through her headset. "General Vale asked for you before he lost consciousness." Erin looked at him. Why Rainier? Why not Madigan? Why not the VA? Dorsey's jaw tightened. Rainier has the newest neuro suite. Mercer pushed for it. Donors funded it. Erin's stomach knotted at the name, but she held her face steady. Dorsey continued. Vale demanded to come here. He demanded Mercer be present. He demanded you be found. That is all I can say. The helicopter dropped toward the hospital roof, the landing lights washing over wet concrete. Soldiers stood in a tight formation around the pad rifles held at rest but ready. The hospital's usual calm was gone. The roof looked like a forward operating base. As the skids touched down, Erin felt the jolt through her bones. The door opened, and cold air and rotor wash slammed into her. She stepped out, and the wind hit her hard, whipping hair loose from her tie. Rain plastered her scrubs to her arms. She walked forward anyway, head down, moving into the storm. At the access doors to the roof stairwell, Dr. Nolan Mercer waited. He looked smaller than she remembered. Not physically. He was soaked and shivering, his perfect hair flattened by rain, his white coat clinging to him like a flag. 3 armed MPS stood close by, positioned in a way that made it clear he was not there by choice. Mercer saw Erin, and his face twisted anger fighting panic. "This is insane," Mercer shouted over the rotors. "She is a terminated employee. She is under review. If she touches him, I will sue this entire facility. I will have all of you court-martialed." Erin kept walking. She did not speed up. She did not slow. She looked past him as if he were a signpost. Mercer stepped into her path, pointing a trembling finger at her. "You do not belong here." Dorsey stepped between them. He did not raise his voice. He simply rested a hand near his sidearm. "Dr. Dorsey said, if you speak to the asset again, I will restrain you and leave you on this roof until the weather changes. Do you understand?" Mercer's mouth opened, then shut. He looked at the MPS, searching for support. None came. Their eyes stayed forward. Their loyalty was not his tonight. Erin walked past Mercer without a word. For a heartbeat, she felt the old anger flare, the memory of the shattered cabinet, the badge clattering onto a tray, the way security had watched her like she was a thief. She let the anger pass through her and out. Anger wasted oxygen. A patient was dying. The stairwell door opened, and the smell hit her immediately. Antiseptic sweat, faint smoke from overheated equipment, and underneath it, a thin metallic note that always meant blood was present even if you could not see it yet. They moved quickly down the stairs, boots pounding behind her. The hospital's overhead lights flickered the building, running on backup systems. Red emergency strobes pulsed in the corners like a heartbeat trying to stay alive. On the main trauma floor, the hallway was crowded with MPS medics, residents, and terrified staff. People pressed themselves against walls as Erin passed. Some faces recognized her and widened. Some turned away as if looking might cost them. Linda Park pushed through the crowd and grabbed Erin's forearm for 1 second, grounding her. "Thank God," Linda whispered. Her eyes were red, and she looked like she had been holding her breath for an hour. "He's in Trauma 1. Caleb is losing it. Brittany can't get a line. Mercer keeps yelling. He's crashing." Erin nodded once. "How long since onset?" Linda shook her head. "Minutes. It started at the Pentagon." "He came in gray." "Any confirmed exposure?" Erin asked. Linda's lips tightened. "They keep saying neurotoxin from a mission. No confirmation. No details. Classified." Erin's eyes narrowed. Classified was a word that killed people when doctors used it to cover ignorance. Dorsey leaned slightly toward Erin. "We have limited time." Erin looked at the MPS lining the hallway, weapons angled down, but ready. "I need space in that room," she said. "No shouting, no crowding. Whoever cannot help should leave." Dorsey spoke once and the words carried without needing volume. "Clear the corridor." Men moved. The hallway opened like a channel cut through rock. As they approached Trauma 1, Erin heard the sound before she saw the door. The chaotic, uneven beeping of an arrhythmia. A ventilator alarming. Someone calling out numbers in a voice that kept rising as if higher pitch could change reality. Inside the room was a disaster. Plastic wrappers littered the floor. Gauze packets were torn open and tossed aside. Syringes lay on a stainless tray uncapped like discarded needles of desperation. The crash cart drawers were half-open items yanked out and not replaced. It looked like a team had been throwing solutions at a problem without understanding the problem. On the bed, Major General Mason Vale convulsed his broad frame, fighting itself. His skin was mottled angry red patches blooming across his neck and chest. His jaw clenched, muscles rigid. His breathing was wet, a sound that did not belong in a man who had been carved from discipline. A resident doctor, Caleb Wright, stood near the monitor, sweat shining on his forehead. His eyes darted between the screen and Mercer, between the screen and the nurses, like he was searching for permission to do something that mattered. Brittany. Sloan, the interim head nurse, fumbled with an IV kit in shaking hands. "I can't get access," she said, voice breaking. "His veins are collapsed." Mercer snapped move and shoved in, trying himself. His hands shook. He missed. Blood spurted onto the sheet. Vale's eyes fluttered open for a fraction of a second. Blue eyes clouded with pain, but sharp enough to take the room in. Erin saw him register the panic. Saw him register Mercer's fear. Saw him register the mess. The monitor screamed. "VFAB," Caleb said, voice cracking. "He's in V-fib." "Charge," Mercer barked, grabbing paddles. "Clear." The shock hit Vale's body and jerked him hard. The line did not return to normal. "Charge again," Mercer shouted. 200. Another shock. Nothing. A nurse whispered, "We're losing him," like it was a confession. Mercer's face went slick with sweat. His eyes flicked to the armed guards at the doorway, then back to the monitor as if he could will the line into obedience. "Epinephrine," Mercer snapped. "Push 1 milligram." Linda moved to comply, hands trembling. And then Vale's hand shot out impossibly fast. He grabbed Mercer by the lapels and yanked him forward, dragging him close as if Mercer weighed nothing. Mercer made a startled sound, half yelp, half plea. The room froze. Vale's voice came out rough, but clear enough to slice through panic. "You do not know what you are doing." Mercer stammered. "General, please lie back. You're in cardiac arrest." Vale's grip tightened. His eyes scanned the room faces of strangers, new hires, fear, confusion. His gaze landed on Linda in the back, tears standing in her eyes. "Where is she?" Vale rasped. Mercer blinked, playing dumb. "Where is who?" "I'm the chief of surgery." Vale's nostrils flared, as if the lie had a smell. "The nurse," he said. "The one you fired." Mercer's face went pale. For a moment, his eyes flicked toward Linda, then away. "She doesn't work here anymore," Mercer said too quickly. "She was incompetent. She was terminated for negligence." Vale stared at him and something shifted in his expression. Not rage, recognition. He saw the lie behind Mercer's words the way he had seen lies in interrogation rooms. "You're lying," Vale whispered. His grip loosened, strength draining, but his will remained. He shoved Mercer back. "Get her," Vale said, and his voice filled the room despite the failing lungs. "Get me the nurse you fired." His gaze locked onto Dorsey at the door. "Or I die on this table and my people take this hospital apart until they find out why." Vale collapsed back, eyes rolling, and the monitor dropped into a flat line that screamed like a siren. Caleb's voice shattered. "He's coding again." Mercer stared at the line, then at the MPS, then at Dorsey. His pride cracked under the weight of consequences. He turned toward Linda, voice shaking. "Call her." Linda did not move at first. Her eyes stayed on Vale, then shifted to Erin as Erin stepped through the doorway. The room did not notice her immediately. Panic made people blind. Then Linda's face changed, relief flooding it so hard she swayed. Aaron, Linda breathed. Mercer spun around, and for a fraction of a second his mouth opened in pure hatred. Then he saw the soldiers behind her, the hard calm of Dorsey, the fact that the night had moved beyond his control. Aaron stepped into the center of the room. The air was thick and hot, the kind of heat that comes from too many bodies and too much fear. She did not look at Mercer. She looked at the patient. Vale's chest rose unevenly. His skin was ashen beneath the rash. His hands were clenched muscles still twitching. Aaron's voice cut through the noise, low and commanding. Who is managing the medication chart? Aaron's voice did not rise, but it changed the room. It cut through alarms and scattered instructions the way a clear command cuts through fog. People looked up as if they had been waiting for someone to speak with certainty. For a second, no one answered. The interim head nurse, Brittany Sloan, stood frozen with a catheter kit in her hands, eyes glassy with panic. Dr. Caleb Wright hovered near the monitor lips, moving silently, as if rehearsing the next order he was afraid to give. Linda Park stepped forward, throat tight. "I am, sort of. We have been pushing what Mercer ordered. Epifluid shock protocol. Nothing is holding." Aaron moved to the bedside. She did not ask permission. She did not look at Mercer. She laid 2 fingers against the general's wrist and felt a pulse that barely belonged to the body it was trying to feed. Thin. Irregular. A pulse that was losing the argument. She looked at the monitor, then at the skin. The angry red blooming on the neck was not the clean, raised pattern of hives. It was flat, blotchy, broken vessels under the surface like a bruise trying to become a rash. Aaron leaned in closer, close enough to feel the damp heat of the general's breath. It came in wet pulls, rattling low in the chest, and beneath the antiseptic she caught something else. A faint metallic sweetness, like pennies pressed between teeth. Mercer finally found his voice again, sharp and offended. "Get her away from him. She is not credentialed. She is under investigation." Dorsey stood at the doorway with the calm of a man who had ended arguments in worse places than hospitals. He did not speak, but his presence made the staff hesitate before obeying Mercer. Aaron kept her eyes on the patient. What was the onset? Caleb answered automatically, grateful for a question he could handle. He collapsed during a briefing at the Pentagon. Seizure, then respiratory distress. He arrived gray. Blood pressure was 70/40 at intake. Heart rate erratic. Aaron nodded once. Any confirmed exposure? Caleb glanced at Mercer. "We suspect a delayed neurotoxin reaction from a mission 3 weeks ago. That is what we were told." Mercer stepped forward, voice tight with the need to control. "He is a special operations commander. Exposure is classified. Treat the symptoms and stop questioning it." Aaron's head turned slowly toward Mercer. Not with fear, with focus. "Which nerve agent?" she asked. Mercer blinked, caught off guard by the bluntness. "Classified." "That is not an answer," Aaron said. "That is a way to hide that you do not know." Mercer's face flushed. "You are out of your depth." Aaron looked back at the general. His jaw clenched hard, his back-arched muscles locking in a rigid spasm that looked like pain translated into movement. "His pupils are pinpoint," Aaron said, more to the room than to Mercer. "That does not match anaphylaxis. This rash is not hives. His breath is wrong. You pushed 3 rounds of epi and nothing improved because you are treating the wrong problem." Brittany's voice came out thin. "Then what is it?" Aaron scanned the IV pole. There were multiple bags, hanging lines tangled from frantic changes, labels turned away from view. She stepped closer, fingers working quickly, lifting each label to the light. Saline, lactated solution, a standard antibiotic. Then her eyes landed on a clear bag with a code printed where a name should have been. EXP Divini Simticetabutsmit. The lettering was sterile, unemotional. Not a pharmacy label. Not a normal hospital tag. Aaron pointed without taking her eyes off it. "What is that?" For a moment, no one spoke. Even the alarms seemed to pause between screams. Mercer answered too fast. "Standard saline with a vitamin mix, immune support." Aaron reached up and lifted the bag, holding it to the overhead light. The liquid inside did not move like saline. It clung to the plastic a fraction longer. A faint, oily viscosity that made her stomach tighten. She looked at the tubing, then the port. The line ran directly into the general's central access. Aaron's voice lowered. "This is not standard inventory." Mercer stepped forward sharply. "Put that back." Aaron did not. She traced the code with her thumb and memory flashed like a file opening. 6 months ago, before she was escorted out, she had walked past Mercer's office with her box and seen a binder on his desk. Thick. Tabbed. Labeled with the same sterile style of coding, not words. She had not stopped to read it because she was trying to keep her dignity intact. She had not needed to read it to recognize the shape of it now. Clinical trial paperwork. Mercer reached for her arm. "You do not touch my equipment." Dorsey moved in one step, a wall of muscle and intent. "Doctor." Mercer froze mid-reach. His eyes flicked to Dorsey's hand near his weapon. The message was simple. "Touch her again, and you become the problem." Aaron lifted the bag off the hook and snapped the clamp shut. The line stopped feeding. She tossed the bag onto the counter beside the monitor with a wet slap. Linda's eyes widened. "Aaron, if he is on a nerve agent protocol, stopping an infusion could—" Aaron cut her off, not cruelly, just urgently. "If you treat a nerve agent with atropine and pralidoxim when it is not a nerve agent, you can kill him faster than the toxin. We need facts, not guesses." Caleb swallowed. "The tox screen is still pending. We do not have time for a lab to tell us what our eyes can see," Aaron said. She turned to the resident. "Get an arterial blood gas now. Get coagulation studies. INR-PTPTT fibrinogen. Get a basic metabolic panel and a lactate. Start a point-of-care glucose. Tell me if his kidneys are failing." Caleb moved as if released from a cage. "Yes." Aaron looked at Brittany. "You are not chasing a vein with a catheter. Give me ultrasound guidance and let someone with calm hands do it. Linda, get the ultrasound in here. And I need 2 large bore lines running wide open." Brittany's cheeks burned, but she nodded, clumsy relief replacing humiliation. Mercer stepped forward again, voice rising. "Stop giving orders. You are not in charge of my trauma bay." Aaron leaned close to the general's face again, watching the way the muscles tightened. A low growl of pain escaped him, even through failing breath. She spoke without looking at Mercer. "Then be useful. Tell me why an experimental infusion bag is hanging on a general's line under your watch." Mercer's eyes darted. "It is not experimental." Aaron's gaze snapped to him. "Then call pharmacy right now and have them tell the room what EXP-914 is. Put it on speaker." Mercer did not move. That silence was louder than any alarm. Aaron turned back to the patient. His skin looked tighter, as if his body was clenching itself into a fist. The monitor flashed a rhythm that kept slipping, trying to fall apart. Aaron spoke quickly now, a controlled rush. Muscle rigidity, cardiac instability, pinpoint pupils, rash that is petechial, not urticarial, breath with metallic sweetness. This looks like a chemical interaction, not a delayed allergy. Linda held out a syringe with trembling hands. Mercer ordered another round of EP. Aaron shook her head. "No. We stop chasing shock protocol. We correct the chemistry." Caleb returned with an ABG cartridge in his hand, eyes wide. "We can run it on the bedside analyzer." "Do it," Aaron said. Brittany finally managed a line under ultrasound. Her hand shook, but the needle slipped into the vessel and blood returned. She exhaled like she had been underwater. Aaron took control of the medication tray. "Linda, I need sodium bicarbonate, now, and I need dantrolene." Brittany's eyes widened. Dantrolene is for malignant hyperthermia. "It is for muscle rigidity and metabolic catastrophe," Aaron said. "And that is what this looks like. His muscles are locking. His heart is slipping. If this infusion is a coagulation agent, and it is interacting with residue in his blood, we are watching his circulation turn into sludge," Mercer snapped. "You're guessing." Aaron's eyes burned into him. "You are lying. Mercer lunged as if the accusation had struck him physically. "I am the chief of surgery. I forbid this." He grabbed Aaron's arm. The crack of impact echoed through the room. Dorsey's baton struck Mercer's forearm with controlled force. Mercer recoiled with a strangled shout, clutching his arm, shock and pain twisting his face. Dorsey's voice was low lethal. "Do not touch her again." Mercer stared at him, eyes wide. And for the first time that night, fear surfaced in him without disguise. Aaron did not even look at Mercer's injury. Her attention stayed where it belonged. On the monitor, the general's rhythm staggered again. A long wobble, then chaos. "Ventricular tachycardia," Caleb said, voice tight. Aaron took the bicarbonate when Linda brought it, her hand steady. "Flush the line. Prepare to push." Linda hesitated. "If we are wrong..." Aaron met her eyes. Linda saw something there that steadied her. Not arrogance. Conviction built on experience. Aaron spoke softly so only Linda could hear. "If we do nothing, we are wrong." Linda nodded. Aaron pushed sodium bicarbonate into the central line, then followed with dantrolene. Her movements were fast, precise, practiced like she had done this under mortar fire. The general's body jerked. His muscles spasmed, then locked harder. The monitor screamed. Then the line dropped. A flat tone filled the room. "Assistal," Caleb said, and his voice broke on the word. Brittany's hand flew to her mouth. A young nurse let out a small sound, half sob, half gasp. Mercer's face shifted into something like vindication. "She killed him," he said, louder now, trying to seize the narrative. "I told you. Arrest her. Get her out of here." Aaron placed her fingers on the general's carotid artery and closed her eyes for half a second, listening through touch, through instinct. "Do not touch him," she said. Caleb stared at the monitor. He is flatlined. Aaron did not lift her eyes. Wait. The room hovered in the pause, trapped between panic and obedience. Even Dorsey seemed to stop breathing. 10 seconds. The longest 10 seconds in the building. Aaron kept her fingers on the artery, refusing to let the room's fear infect her hands. Then, under her fingertips, a faint thump answered. On the monitor, a jagged green line snapped back to life. Thump, thump. The rhythm staggered, then stabilized. The angry red on the general's neck began to fade, not instantly but visibly, like a fire losing oxygen. A deep breath tore out of the general's chest, raw and wet, but real. Brittany's knees nearly buckled with relief. Linda let out a sob, quiet and broken. Caleb whispered, stunned, "He is back." Aaron opened her eyes. She did not smile. She only leaned closer, watching the general's face as it shifted from gray toward human. The general's eyes fluttered, then opened fully. The cloudiness in them cleared as if someone had wiped glass clean. He turned his head slightly and his gaze landed on Aaron. For a moment, the room fell away. No alarms, no MPS, no Mercer. Just a man who had been to the edge and recognized the voice that had guided him there before. His lips moved. The words came out weak but steady. I knew he rasped. I knew the voice. Aaron exhaled, and she realized her lungs had been holding air as if she had been underwater with him. "You cut it close," she said quietly. The general's mouth twitched, not quite a smile. Then his eyes shifted past Aaron, scanning the room with the same predator focus that had once commanded men in the dark. He found Mercer. Mercer stood near the cabinet, clutching his forearm. Face-pale hair plastered to his head. He looked smaller now, not because his body had changed, but because the room had. The general lifted his head a fraction and spoke toward the doorway. "Sergeant Major." Dorsey stepped closer. "Sir?" The general nodded toward the bag on the counter. "Secure that infusion bag," he said. "Do not let anyone touch it. Photograph it. Seal it. Chain of custody." Dorsey's eyes flicked to the bag and back. "Yes, sir." The general's gaze stayed on Mercer. His voice sharpened. "And secure the doctor." Mercer's mouth fell open. "General, you do not understand. That was a breakthrough treatment. I was trying to save you. You are alive because I took initiative." Aaron's voice cut through him, calm and merciless. "You were trying to secure a patent." Mercer snapped toward her. "Shut your mouth." Aaron did not blink. "I saw your trial binder months ago. I did not know what it was then, but I know what this code is. It is not a hospital label, it is a research designation. Caleb looked between them, shock sharpening into understanding. Mercer's face tightened. You have no proof. Aaron gestured to the bag. That is proof. Your silence is proof. Your refusal to identify the agent you claim he was exposed to is proof. Mercer's voice rose into desperation. You cannot accuse me in front of military police. Do you know who I am? Do you know what I have built? The general's eyes hardened to ice. I know exactly what you built. He shifted, trying to sit up, and Aaron immediately placed a hand on his shoulder. Easy, she said. Your heart is still unstable. I'm not finished, the general said. And though his body was weak, the command in his voice filled the room. Dorsey stepped forward. 2 MPSs moved in behind Mercer, hands ready. Mercer's posture changed. He tried to reclaim control with volume. This is unlawful. You cannot detain me. I have attorneys. I have board protection. The general's voice was quiet now, and that made it worse. Dr. Mercer, he said. You just attempted to kill a major general of the United States military with an unauthorized infusion. You will be detained. You will be questioned. And you will not leave this building unless I allow it. Mercer's face went gray. His knees looked unsteady, like his body was realizing what his mind had refused to accept. This is insanity, Mercer whispered, but the word landed weak. Aaron watched Mercer's eyes flick toward the door, toward the corridor, toward escape. The instinct of a cornered man. Dorsey gave a small nod. The MPs moved in, taking Mercer by the arms. Mercer jerked, trying to pull free, but he was not fighting nurses anymore. He was fighting men trained to restrain targets who did not want to be restrained. Mercer shouted as they dragged him back. You cannot do this. I am the chief of surgery. I bring in millions. I am protected. No one answered him. Not even Brittany. Not even the administrators who had once stood behind him. His voice faded into the hallway. Silence returned, broken only by the steady beep of the monitor and the wet rasp of the general's breathing. Aaron turned back to the bedside, adjusting the oxygen, checking the line, watching his chest rise. She kept her movements gentle, but her eyes stayed sharp. Caleb stood close shaken. What do you need? Aaron looked at him. I need honesty. From everyone. We are not treating a rumor. We are treating a body. Caleb nodded quickly, eager. Yes. Aaron glanced at Brittany, who stood near the IV pole, still pale. You did get access. Good. Now keep the lines open, but do not hang anything new until I see it. Every bag gets verified. Brittany nodded, swallowing hard. Yes, I am sorry. Aaron did not respond to the apology. Not because she did not hear it, but because the moment was bigger than Brittany's guilt. She checked the general again, eyes scanning for subtle changes. The rigidity was easing. The rash continued fading, leaving behind mottled patches. She looked at Linda. Linda's eyes were wet, but she was steady again now that Aaron was here. Aaron lowered her voice. How long has that bag been running? Linda swallowed since he arrived. Mercer ordered it. He said it was a supportive infusion because the NeuroSuite donors funded new trial protocols. Aaron's stomach tightened, and no one questioned it. Linda's face twisted in shame. We did. He shut us down. Aaron nodded once. That was the system. You could question, but you could not challenge not without being punished. The general's hand lifted weakly. Aaron noticed and caught it before it fell. His grip was surprisingly firm for a man who had flatlined minutes ago. He looked at her eyes, sharp despite exhaustion. You should not be here, he rasped. They burned you. Aaron's throat tightened. I did not come for them. His eyes held hers. I came for you. Aaron frowned slightly. You demanded to come to Rainier. Yes, he said. I demanded Mercer. I demanded this building. Aaron's pulse quickened. Why? The general's gaze moved to Dorsey, then back to Aaron. His voice dropped gravelly and controlled. Clear the room, he said. Caleb blinked. Sir, we need to monitor. His rhythm is still unstable. The general's eyes sharpened. Out. Dorsey stepped forward, voice carrying authority without volume. Everyone out except Nurse McCall and me. People moved quickly. Caleb hesitated for half a second, then obeyed. Linda looked torn, then stepped back into the hall. Brittany followed, eyes down. The last nurse pulled the door closed, sealing the room into a pocket of tense quiet. Only Aaron Dorsey and the general remained. The monitor beeped in steady rhythm, a metronome keeping time. The general shifted his head, wincing. Aaron steadied him with a hand on his shoulder. "Do not sit up," she said. "Talk without moving. Your lungs are angry and your heart is still recovering." The general swallowed, then spoke with effort. Mercer was not just testing a drug to get rich. Aaron held his gaze, listening. "He was paid," the general continued. "Paid to make sure I did not wake up from the treatment." Aaron felt cold spread through her chest. Paid by who? The general's eyes narrowed as if he were focusing through pain. "We have been tracking a leak in defense contracts. Procurement, logistics, classified equipment. Someone has been siphoning money through shell companies, laundering it through grants and donations. Rainier's new wing. The NeuroSuite. Donors that look clean on paper." Aaron's mind raced, trying to connect it to what she had seen. The glossy fundraising posters in the lobby. Mercer shaking hands with men in suits. The way policies tightened under the banner of efficiency. Dorsey's jaw tightened. His hand rested near his weapon, instinctive. Aaron spoke quietly. "You are saying the hospital was part of the laundering?" The general nodded a fraction. "A node, not the whole network. But enough." Aaron's voice sharpened, and Mercer. The general's mouth tightened. Mercer thought he was doing a risky trial. He thought he could call it innovation. But his handlers knew exactly what would happen when that infusion met what is already in my system. They knew it would be fatal. Aaron stared at the general's face, seeing the controlled fury beneath exhaustion. "So Mercer is a tool, a useful idiot," the general said. Aaron felt anger rise not at Mercer alone, but at the machinery that made men like Mercer possible. She forced it down, focused on the practical. "Your system, whatever is in your blood, it is still there. We stabilize the reaction, but the underlying exposure remains. We need a true tox panel. We need imaging. We need respiratory support." The general's gaze did not soften. "We will do those things. But understand this. Now that I am alive and Mercer is detained, the people who paid him will not walk away." Dorsey's eyes flicked to the closed door. "Sir, we have a perimeter." The general's voice was faint but firm. "Perimeters fail when money buys keys." Aaron opened her mouth to ask another question, but Dorsey's earpiece crackled. The sound was low, but in the silence it was sharp. Dorsey lifted a hand to it, listening. His face changed in increments, like a man reading a bad report without wanting to show it. Aaron watched him. "What is it?" Dorsey's voice came out controlled, but the muscle in his jaw jumped. "Building security reports the main power grid has been cut," he said. "We are on backup generators." Aaron's eyes flicked to the overhead lights. They were already dimmer than normal, humming with strain. The red emergency strobes pulsed like a warning. The general's fingers tightened around Aaron's hand. Dorsey continued, eyes distant as he listened to the earpiece again. Electronic locks on the psychiatric ward, and the basement quarantine levels just disengaged. Aaron's mouth went dry. "Disengaged how?" "Open from inside," Dorsey said. "We have a full facility lockdown, but internal doors are releasing." The monitor beeped steadily, indifferent to the shift in the world. Aaron looked at the general. "If the locks are releasing, that is not a malfunction. That is a decision." The general's eyes held hers hard and clear. "They are not coming to arrest Mercer," he said quietly. "They are coming to erase evidence." Aaron's hand tightened on his. She could feel the tremor in his fingers now, not fear strain. His body was still recovering, and the room was changing around them. Dorsey took a half step toward the door posture, shifting into readiness. "Sir, I recommend relocation." Aaron's mind moved faster than her body. She pictured corridors with flickering lights, terrified staff doors opening, where they should not, people released who should be contained. She pictured smoke if power failed, further ventilation systems going dead, panic turning medical floors into stampedes. She looked down at the general's chest, rising and falling, still fragile. She looked back at Dorsey, who had already become a shield. Then she looked at the counter where the infusion bag sat sealed now as evidence, a small clear object that had almost killed a man and could topple much more than one career. Aaron spoke, voice low and certain. Can he stand? The general's eyes narrowed. A faint, grim curve touched his mouth. With you here, I can. Aaron nodded once, and she reached for the edge of the bed, preparing to move him without wasting a second. Aaron slid her arm beneath Mason Vale's shoulders and counted his breaths the way she counted heartbeats. He swung his legs off the bed, bare feet finding the cold floor tiles. His body trembled once, not weakness alone, but the effort of forcing damaged lungs to cooperate. He gritted his teeth and stood anyway, tall enough that the room seemed to bend around him out of habit. Hank Dorsey opened the trauma bay door an inch and looked into the corridor. The red emergency strobes made every movement outside look broken into frames like a film skipping. Shadows ran past. A cart overturned somewhere with a metallic shriek. Then a scream, high and raw, cut through the hall and stopped abruptly. Dorsey shut the door again. They are inside. Aaron felt the change in the air. Hospitals had their own kind of danger, the danger of time and bodies and mistakes. This was different. This was intent. She moved to the counter and yanked open a lower cabinet. Her fingers found a soft black bag stuffed behind spare blankets. A go bag. She had built it years ago after a mass casualty night that taught her how quickly order turned into chaos. She dumped the contents onto the counter, hands moving fast. Tourniquets. Pressure dressings. Hemostatic gauze. Chest seals. Morphine auto-injectors. Trauma shears. A small headlamp. A roll of tape. A packet of airway adjuncts. 2 saline flushes. A compact pulse oximeter. 1 emergency epinephrine vial. A set of gloves. Linda Park had been right. Aaron had not stopped being a trauma nurse. She had only been forced to practice it in smaller rooms. Take only what you can carry. Aaron said to herself, then looked at Dorsey. How many are with you? Dorsey's eyes stayed hard. 4 MPS on this floor. 2 outside the stairwell. Rangers are not on site. Vale coughed a wet sound that ended in a grimace. No one is coming to save us inside these walls. Aaron zipped the bag and swung it over her shoulder. The strap cut into her collarbone, familiar pressure, the weight of responsibility made physical. Dorsey stepped to the bedside and reached down, retrieving a compact pistol from an ankle holster. He checked the chamber with a controlled click, then held it out to Vale without looking back. "Sir Condition?" Dorsey asked. Vale took the weapon in both hands for a moment, testing grip, feeling recoil in his mind more than his body. "Operating at 40%, he said. His voice was hoarse, but the old command lived in it. Enough to be a problem. Dorsey nodded once. "You are in the middle, Aaron. Stay low, stay close, do not stop unless I tell you." Aaron felt the strange jolt of hearing her name like that placed into formation, not dismissed as staff. She looked down at her stained scrubs and then back up at the 2 men. "I am not the one who needs a reminder to stay alive," she said. Vale's mouth twitched almost a smile. Then another cough took it away. Dorsey cracked the door again. The corridor was worse. The emergency lights pulsed, making the hallway look like it was breathing. A gurney lay on its side near the nurse's station, wheels still spinning slightly. Paper charts and plastic wrappers fluttered across the floor like dead leaves. A young nurse crouched behind the counter, hands over her ears, eyes wide and unfocused. When she saw Dorsey, she tried to speak, but only a croak came out. Dorsey scanned the far end of the hall. Roof is no go. If they control the perimeter, they have eyes on the helipad. Aaron's mind raced. Then where? The sublevel, Dorsey said. Steam tunnels connect to the city grid. It is our cleanest exit. Vale's gaze sharpened. Move. They stepped into the corridor. The first few yards were quiet except for distant chaos. The kind of quiet that felt wrong, as if the building were holding its breath. Aaron stayed between them, her hand gripping the strap of her go bag, her other hand free, ready to grab a wall if Vale collapsed. They moved past the central nurses' station. Monitors beeped from abandoned bays. A computer screen glowed with a frozen chart cursor blinking patiently as if nothing had changed. Erin saw a half-eaten granola bar on the counter dropped in mid-bite. The small details made her stomach twist more than the screams. A crash echoed from a stairwell door ahead. Dorsey lifted a hand fist, closed, halt. They pressed against the wall. Erin felt Vale's breath behind her wet and uneven. Dorsey leaned forward, listening. Another crash. Then the door slammed open. A man stumbled out wearing a torn hospital gown, bare feet slapping the tile. His hair was wild. His eyes were huge pupils blown wide. He bellowed incoherently, a sound of pure aggression. In his hand he held a broken IV pole like a spear. Erin recognized the look instantly. Not just psychosis. Stimulation. Chemical fire in the brain. The man's gaze latched onto her first. He charged. Erin dropped, not thinking muscle memory, snapping her into a crouch. The IV pole swung over her head with a metallic whistle. Vale moved. Despite the tremor in his hands, despite the pallor under his skin, he stepped inside the man's swing with brutal efficiency. One strike to the solar plexus, then a hard sweep. The man folded and hit the floor with a breath, stealing thud, rolling and groaning. Vale leaned against the wall immediately after, eyes squeezing shut for a fraction of a second as if his chest had been punched from the inside. Erin was at his side. "Do not do that again," she said, fingers finding his pulse. It hammered and skipped, irregular rhythm like a drummer losing count. Vale forced air in. "He was going to split your skull." Erin looked down at the man on the floor. His pupils were still wide, his jaw working the saliva at the corner of his mouth. "They did not just open doors," she said quietly. "They dosed them. Something to amp aggression. They turned patients into noise." Dorsey moved to a reinforced window at the end of the hall and peered through rain-streaked glass toward the main entrance. His posture went rigid. "Sir," he said, voice grim, "we have company." Erin stepped close enough to see past him. 4 unmarked tactical vans screeched to a halt at the front steps. Men poured out in full-body armor rifles up, moving in tight pairs. They did not move like police. They moved like contractors. Clean, fast, purposeful. Vale's jaw tightened. "Mercenaries," he said. "Cleaners." Erin felt cold spread under her skin. "Cleaners for what?" "For us," Vale said. "For the infusion bag. For anyone who saw Mercer. For everyone in Trauma 1. A metallic bang echoed from the stairwell behind them. Someone was coming up fast. Dorsey's hand moved to his vest. Flash. Vale did not hesitate. Frag the doorway. Dorsey pulled a flashbang from his gear, thumbed it, and tossed it toward the stairwell door, just as it burst open. 3 figures in black tactical gear stepped through. The world turned white. The concussion punched Erin's chest. Her ears rang hard, and for a moment, all she saw were silhouettes, staggering hands flying to helmets. "Move!" Vale roared, voice ripping through the ringing. "Go!" Dorsey shoved Erin toward the opposite stairwell, the one leading down. Erin grabbed Vale's forearm and hauled, half pulling, half guiding him into motion. They burst through the door and into the stairwell. Automatic gunfire erupted above them, chewing into the doorframe they had just passed. The heavy fire door held, but the sound made Erin's teeth vibrate. Down Dorsey shouted, "Fast!" They descended. Erin's shoes slipped on wet concrete steps. Vale's breathing turned harsher with each level. Dorsey stayed behind them, weapon angled up ready to fire if the door blew open. The air grew colder as they went damp and industrial. The smell changed from disinfectant to mold and harsh cleaner. The emergency lights were fewer down here, long stretches of darkness punctuated by the pulse of red strobes that made the walls look like they were bleeding. Vale coughed again. This time, blood flecked his lip. He wiped it with the back of his hand, a grim gesture that tried to pretend it meant nothing. Erin saw it anyway. They reached the sublevel corridor, a maze of service doors and humming generators. Signs pointed toward morgue, laundry, maintenance. Aaron's pulse kept time with the distant roar of chaos above. Dorsey slowed at a junction and held up a fist. Hold. They pressed into the shadow of a massive boiler, the metal warm even in the cold air. Water dripped somewhere. The thrum of backup generators vibrated through the floor. In the quiet, Aaron heard a sound that did not belong. A whimper. Dorsey turned his head slowly, scanning. The whimper came again from behind a stack of linen carts. Dorsey moved with predatory silence, weapon raised. He rounded the carts. Curled on the concrete floor, soaked and shaking, was Dr. Nolan Mercer. His expensive coat was gone. His dress shirt was torn. His face was smeared with grime. He looked up, eyes wide, and for a moment the mask was gone. He was not a chief surgeon, not a bored darling. He was just a man who understood he could die. "Do not shoot," Mercer babbled. "Please, do not shoot." Dorsey's voice cut low, quiet. Mercer scrambled to his feet. Then he saw Vale and Aaron. Fear flickered into something else, rage and desperation curdling together. His eyes locked onto Aaron like she was the cause of all of it. "You, Mercer," shrieked, voice echoing off concrete. "This is your fault. You ruined everything." Aaron did not flinch. She kept her body between Vale and Mercer, not out of fear of Mercer's strength, but out of habit. She read his hands, his posture, his eyes darting toward the tools and pipes. Mercer stepped forward, hands shaking. "I was going to be Surgeon General. I had the board. I had the donors. All I had to do was keep you out and keep him quiet." Aaron's voice came out cold. "Keep him quiet." Mercer's mouth twisted. "They said it had to look natural. A complication, a reaction. I was solving problems. I was saving the system." Vale's eyes burned into him. "You were selling a soldier." Mercer's gaze snapped to Vale, hatred and pleading mixing. "You do not understand the pressure, the expectations. They promised me protection." Aaron saw it in Mercer's face, then the sick truth, that he still believed he was the victim. Mercer's hand reached toward a shelf and grabbed a heavy pipe wrench. He raised it, eyes frantic. "You think you are a hero. You are nothing. A fired nurse with delusions." Vale lifted his pistol, aim steady despite the tremor. "Drop it." Mercer hesitated. The wrench shook in his grip. Then the far door of the boiler room exploded inward with a violent bang. Debris sprayed across the floor. 4 mercenaries poured through the breech weapon lights, cutting the darkness into sharp white slices. Their rifles swung in unison. "Contact," one of them called, voice flat. Dorsey opened fire, immediately controlled bursts that forced them to duck behind the doorway. Aaron grabbed Vale and shoved him behind the boiler's concrete base. The air filled with supersonic cracks, bullets sparking off metal ricochets, whining like angry insects. Mercer did not take cover. His brain broke under panic. He saw the men in black and believed they were his rescue, his promised protection. He dropped the wrench and ran toward them, arms waving. "Wait," Mercer screamed. "I am Dr. Mercer. I am the asset. I am on your side. I can help you find them." The lead mercenary did not slow. He raised his rifle without emotion. "No loose ends," he said. A short burst. Mercer jerked as if yanked by strings. 3 red blooms spread across his chest. His eyes went wide with surprise more than pain. He looked down at himself, hands hovering as if he expected to find a mistake. Then he collapsed onto the wet concrete, the sound of his body hitting the floor shockingly ordinary. Aaron's stomach clenched, but she did not look away long because Dorsey made a sound she had heard too many times. A grunt, sharp, involuntary. He spun slightly, then dropped to one knee. Blood poured over his shoulder, dark against tactical fabric. "Man down!" Aaron shouted, voice slicing through gunfire. Vale leaned out from behind the boiler and fired steady rhythm, forcing the mercenaries back behind the breach. His slide locked for a second, then he reloaded with shaking hands that still remembered the motion. Aaron bolted from cover. Bullets chewed the floor around her feet, sparks jumping. She stayed low, sprinting the short open space and sliding behind a metal workbench beside Dorsey. Dorsey's face was pale, but his eyes were still sharp. "Go," he gasped. "Get the general out. I will hold." Aaron ripped open his vest with trauma shears. The wound was ugly, through and through the deltoid arterial bleeding. She did not waste words. "I have you," she said. She pulled a tourniquet from her bag and cranked it high on his arm. Dorsey groaned through clenched teeth. Erin packed the wound with hemostatic gauze pressure hard enough that her fingers hurt. "You do not die," she said. "Not here." Vale shouted over gunfire, voice rough. "Erin, they are bringing grenades." Erin finished the dressing and hauled Dorsey to his feet. He was twice her size, but adrenaline gave her strength that did not belong to her muscles. She hooked his good arm over her shoulder and adjusted her stance. The tunnel she called back to Vale. 50 yards behind the generator. Vale fired 2 more shots, then moved, covering their retreat. His breathing sounded like rusted metal, wet and dragging. They moved in staggered steps, Erin, carrying Dorsey, Vale limping behind, pistol up. The boiler room shook with another explosion as a grenade detonated near the breach. Metal screamed. Dust filled the air. They reached the steam tunnel entrance, a heavy industrial door, half hidden behind pipes. Erin shoved it open with her shoulder and pushed Dorsey through. Vale followed, coughing hard blood, splattering his hand this time. Erin reached back, grabbed his sleeve, and pulled him in as the next explosion collapsed part of the boiler room behind them. The entrance slammed shut under debris and twisted metal. The sudden quiet was suffocating. Not peace, just distance from immediate gunfire. The steam tunnels were a different kind of hell. Narrow concrete corridors lined with pipes that hissed and dripped. Heat pressed in from every side, turning breath thick. Rats scurried along the edges, their claws clicking. Water ran in shallow streams along the floor, mixing with grease and grime. Erin forced herself forward, 1 foot in front of the other, carrying Dorsey as his weight dragged against her shoulder. Vale moved on her other side, 1 hand on the wall for balance, the other holding the pistol. His breathing was ragged. Every few steps he coughed, wet and deep flecks of blood catching the dim light. Erin's mind split into tasks. Dorsey's bleeding. Vale's lungs. Direction. Threat behind. Oxygen. Distance. Dorsey's voice came out strained. "Left at the 3rd junction. That leads toward the city grid." Erin nodded, sweat stinging her eyes. Vale stopped, briefly pressing his back against the wall. His knees bent as if his body had decided it had given enough. "Leave me," Vale rasped. "Take him." Erin turned her head sharply. "No." Vale's eyes lifted to hers, glazed at the edges. "Erin." She adjusted Dorsey on her shoulder and stepped closer to Vale, grabbing the front of his tactical vest. Her hands dug into the fabric. "We move together," she said. "Or we do not move." Vale's mouth tightened. "That is an order." Erin's voice hardened. "I do not work for your rank. I do not work for Mercer. I do not work for this hospital. I am unemployed, which means you can keep your orders and use your legs." She hauled him upright with a grunt. Vale's eyes widened slightly, a flash of respect cutting through pain. "Why, Vale?" asked, voice quieter now. "After what they did to you." Erin kept moving, pushing him forward with her grip on his vest. Her shoulders screamed. Sweat soaked her scrubs. Her breath burned. "Because I am a nurse," she said. "That does not turn off because people decide I am inconvenient." They trudged through the tunnel's heat and darkness pressing in. Erin's muscles trembled, but she did not stop. The only light came from her headlamp, a narrow beam that caught graffiti on walls and the shine of moisture on pipes. At last, the tunnel sloped upward. A rusty ladder rose to a heavy manhole cover. Cold water dripped through holes, a different smell, rain and city air. Dorsey shifted his weight. "I can climb," he rasped, though his face said otherwise. Erin nodded. "You go first." Dorsey climbed, 1 hand strong, the other useless. He shoved the cover aside with a grunt and disappeared into the night. A moment later, his voice came down low, clear. Erin helped Vale up the ladder next. His boots scraped metal rungs. He coughed halfway up, body shaking, then forced himself higher. Erin pushed from below, palms against his calves, then climbed after them. They emerged into an alley 3 blocks from Rainier rain falling hard. The city sounded muted, as if the storm had wrapped it in cloth. Sirens wailed faintly in the distance, but not close enough to help. Vale leaned against a dumpster, shoulders heaving. Blood streaked his chin. Dorsey stood beside him, weapon up, scanning. Erin wiped rain from her eyes. "We need a phone. We call the police." Vale's head shook once. "No police." Erin stared at him. "We do not have options." Vale's voice was a rough whisper. "The people who paid Mercer own the commissioner. If we call, they track the location and finish the job." Erin's stomach dropped. "Then who?" Vale opened his mouth to answer, but headlights flooded the alley from both ends. 2 black SUVs rolled in and blocked the exits. Their engines idled low and steady like predators purring. Doors opened. 6 men stepped out in tactical gear, rifles raised. Not the chaotic mercenaries from the hospital. These men moved with fluid precision, eyes scanning, spacing perfect. Professional. Erin stepped in front of Vale without thinking, arms spreading slightly, a useless instinct that still insisted on trying. Dorsey lifted his weapon, one-handed, jaw clenched. A man in a suit stepped forward under a black umbrella. He looked like a banker, hair neat, face calm. But his eyes were dead, the eyes of someone who had ordered deaths from comfortable rooms. He spoke as if discussing weather. "End of the line, General Vale." Vale pushed off the dumpster, standing tall even as his body betrayed him. He moved in front of Erin, shielding her. "You want me," Vale growled. "Take me. Let the civilian go." The man smiled faintly. "No witnesses. You know the rules." Erin's fingers found Vale's hand and squeezed, not romantic, not sentimental, just contact, a tether. The man lifted his hand, a simple gesture that would turn rifles into thunder. Erin closed her eyes for a fraction of a second, bracing for sound. It did not come. Instead, the night filled with a roar so loud it shook water from puddles. Rotor blades. A spotlight dropped from above like judgment, turning the alley into daylight. The men in tactical gear flinched, raising arms to shield their eyes. A loudspeaker boomed overhead, voice hard and official. "Drop your weapons. United States Army Rangers, down now." Fast ropes fell out of the darkness. Figures descended in multicam, moving with speed that made the killers on the ground look slow. Red laser sights painted chests. Commands snapped through the air. On the ground, now. The men in tactical gear hesitated for half a second, then dropped rifles and knelt, hands up. They understood what overwhelming force looked like. The suited man turned his head slowly, face cracking for the first time. Surprise, then calculation, then fear. A ranger captain strode forward through the rain, ignoring the mercenaries being zip-tied. He went straight to Vale and snapped a salute. "General Briggs sends her regards, sir," the captain said. "We picked up your distress beacon." Vale's eyes flicked to Dorsey, then back. "Beacon," he rasped, as if the word cost breath. Dorsey's mouth tightened. "Standard contingency," he murmured, almost apologetic, like he had kept a secret out of duty. Vale tried to speak again, but his body finally took the debt it was owed. His eyes rolled back. He collapsed. Erin caught him with both hands, knees hitting wet pavement. The ranger captain grabbed Vale's shoulders and eased him onto the ground, calling out. "Medic," he shouted. "Priority 1. A ranger medic sprinted in, kneeling beside Erin. "What do we have?" Erin's voice snapped into clinical clarity. Wet hair plastered to her face, hands already checking pulse and airway. "Chemically induced coagulopathy with respiratory compromise and smoke exposure," she said. "High-flow oxygen now. 2 large bore lines wide open. Monitor rhythm. He has been in and out of arrest. He is fragile." The medic blinked at her, registering the authority in a woman wearing stained scrubs. "Yes, ma'am," he said. Erin pressed 2 fingers to Vale's carotid again. The pulse was there, weak but present. She held his hand, feeling how cold it was getting in the rain. "Stay with me," she said, voice low enough that only he might hear it. Vale's eyelids fluttered. His lips moved barely. "I got the nurse," he whispered. Erin swallowed hard, rain mixing with something else on her cheeks. She tightened her grip on his hand. "You did," she said. "Now let the nurse do her job." The medics lifted Vale onto a stretcher and started moving toward the helicopter. Erin stood, shoulders shaking from exhaustion and adrenaline, and followed alongside her go-bag still strapped to her body like a second spine. Behind them, rangers secured prisoners. The suited man was forced to his knees, umbrella discarded in a puddle. His calm was gone. His eyes darted around like an animal caught in headlights. Dorsey leaned against a wall, pale but upright, his tourniquet holding his breathing shallow. A medic moved to him, starting an assessment, but Dorsey's eyes stayed locked on Aaron and Vale until they were at the helicopter. Aaron climbed in with the medic team without being asked. No one stopped her. Inside the aircraft, the noise swallowed everything again. The medic adjusted the oxygen mask. Another started an IV. A third monitored the rhythm. Aaron stayed at Vale's head, watching his chest rise, watching the color of his lips, counting breaths, feeling the way his body fought to remain. The helicopter lifted, and Tacoma dropped away into rain and light. Aaron's hands did not tremble. Not now. Not with a life in front of her that still needed holding together. The helicopter cabin shook with weather and engine vibration, but inside the noise there was a pocket of focus. Aaron stayed at Mason Vale's head, watching the rise and fall of his chest, the way she would watch a fuse burning toward a charge. The ranger medic adjusted the oxygen mask, then glanced at her, reading her face like a chart. "Pressure is soft," he shouted over the rotor roar. "We are giving fluids." Aaron leaned closer to Vale's mouth. His breaths were still wet, still hard, but they were there. She put 2 fingers on his neck again and felt the pulse fight for shape. "Do not flood him," she said. "Keep him perfused, not drowned. His lungs are already angry." The medic nodded and relayed the adjustment without ego, as if he had decided long ago that competence mattered more than rank. Another medic secured the IV, taped it down, then looked at Aaron's stained scrubs and said nothing because the work spoke for her. Below them, Tacoma blurred into rain and sodium lights. The hospital shrank into a dark block with a red pulse of emergency lighting, a building that now looked less like a place of healing and more like a contested site on a map. Vale's eyelids fluttered. He tried to speak again, but the effort turned into a cough, thick and metallic. Aaron held the suction close and cleared his airway before it could become a problem. "You do not talk," she told him. "You breathe." His hand found hers and squeezed once weak but deliberate. Dorsey sat strapped into the opposite seat, his shoulder wrapped tight tourniquet still high. A medic had started an assessment, but Dorsey's eyes kept tracking Aaron and Vale like he was still on perimeter duty. Every time the helicopter hit turbulence, his good hand tightened on the strap. Not fear, vigilance. The ranger captain leaned in, headset on, voice steady. "We are taking him to Madigan. Secure wing." Aaron looked up. No Rainier. The captain's gaze flicked to hers. No Rainier. That simple agreement felt like a door locking behind them. When the helicopter touched down, the world rushed in with bright lights and cold air. The secure wing at Madigan was quiet. In the way controlled places were quiet, the kind of quiet built by armed guards and sealed doors. Vale was transferred onto a gurney, monitors reattached, oxygen kept high. Aaron walked beside him without being asked, her hand never leaving the rail. A military physician met them at the threshold. Older, calm eyes, sharp. He glanced at Aaron. "Name?" he asked. "Aaron McCall," she said. The physician's eyes narrowed for a fraction. Recognition of a file, a rumor, a controversy. Then he looked at Vale's vitals, and that was all that mattered. "What did you give?" he asked. Aaron listed it without embellishment. Sodium, bicarbonate, dantrolene oxygen support, line management, hemorrhage, control on Dorsey, and discontinuation of an unidentified experimental infusion. The physician's mouth tightened. Experimental infusion. Aaron nodded. Coded bag labeled EXP-914. It was running into his central access at Rainier. It was not standard inventory. The physician's gaze lifted briefly toward the ranger captain. The captain answered without being asked. "We secured the bag. Chain of custody is active. We also have the handler in custody." The physician exhaled through his nose. "All right, move him." Vale disappeared behind the doors into bright surgical light and controlled hands. Erin stood at the threshold until the doors shut, and only then did she realize her knees were shaking from delayed exhaustion. A staff sergeant offered her a chair. Erin sat elbows on her thighs, hands clasped tightly enough to ache. She stared at the floor tiles while her body tried to decide whether it was still in danger. Dorsey was wheeled past in the opposite direction, shoulder stabilized. He turned his head toward her as he passed. "You did good," he said, voice rough. Erin's lips pressed into a line. "You got shot." Dorsey gave a faint grunt that might have been a laugh. Occupational hazard. An hour later, a door opened, and the military physician stepped out, pulling off gloves. His face was controlled, but his eyes carried relief. "He is stable," he said. "Not out of the woods, but stable. We are managing respiratory damage and metabolic instability. He is a hard man to kill." Erin let out a breath she had been holding since the alley. The physician studied her for a beat. "You were right to stop the infusion. Labs show a severe coagulation disturbance consistent with a chemical interaction. We are running full tox and cross-referencing with classified exposure profiles." Erin nodded once. She did not need praise. She needed confirmation that her hands had not betrayed her. A pair of men in plain clothes approached badges clipped to their belts. One introduced himself as an investigator for military criminal affairs. The other said less, which told Erin more. They asked Erin to speak in a conference room. Erin followed, still wearing dog hair and bleach stains still smelling like rain and metal. Inside the room, a recorder was placed on the table. A folder was opened. Photos were slid across, including the EXP-914 bag, its code visible, its fluid clinging slightly to the plastic even in a still image. Another photo showed Dr. Nolan Mercer on the boiler room floor, white shirt dark with blood. Erin stared at the image for a second, then looked away. She did not feel triumph. She felt the empty cold of seeing a man destroyed by choices he refused to own. The investigator's voice stayed neutral. "Walk us through your termination at Rainier." Erin spoke carefully, giving facts, not emotion. PFC Tyler Grant. Anaphylaxis. Locked cabinet requiring Mercer's authorization. The decision to break the lock, the stabilization. Mercer's firing order, the flagged license. The second man took notes without looking up. The investigator asked, "Did you see evidence of trial materials before your termination?" Erin hesitated. She remembered the binder on Mercer's desk. She remembered the coded tabs. She remembered the feeling of not wanting to look because looking would mean confronting something she could not fix. "I saw a binder on his desk," she said. "I did not read it. It looked like clinical trial paperwork. Coded. The same style as the infusion bag label." The second man finally looked up. "And tonight you believe the infusion was used as an unauthorized experiment." Erin met his eyes. "I believe it was administered without informed consent. I believe it was concealed. I believe it interacted with whatever exposure he had and nearly killed him." The investigator nodded. "We will corroborate with inventory records, trial registrations, donor logs, and electronic access." Erin's mouth tightened. Rainier's systems were compromised. Power was cut. Locks disengaged. Staff fled. Records may be altered. The investigator's expression did not change. "We already pulled mirrored backups from off-site. Someone at Rainier did not expect that." Erin felt a small grim relief. Not satisfaction, just the sense that the world had not completely lost its ability to preserve truth. After the interview, Erin stepped into the hallway again. A nurse in crisp Madigan scrubs offered her water. Erin took it hand still steady and drank slowly. Linda Park appeared at the far end of the corridor escorted by a soldier. She looked exhausted, hair pulled back hastily, eyes red. When she saw Erin, she stopped as if her body had been waiting for permission to collapse. Erin walked to her. They stood facing each other under bright hospital lighting that made both of them look washed out. Linda's voice shook. "I thought you were going to die in that building." Aaron swallowed. I thought you were. Linda's eyes filled. She blinked hard. They are interviewing staff. They took Brittany. They took Caleb. They took the administrators. Aaron nodded. They will want statements. Linda nodded back, then whispered, I am sorry. Aaron reached out and squeezed Linda's hand once. You called me. That mattered. Linda's shoulders sagged as if that small absolution took weight off her spine. Later, Caleb Wright walked past, guided by an investigator. He looked like he had not slept in days. When he saw Aaron, he stopped. Aaron, he said, voice tight, I should have backed you up 6 months ago. Aaron held his gaze. Caleb looked younger than he had in Trauma 1, stripped of his borrowed authority. You were trying to survive a system, Aaron said. So was I. Caleb's jaw tightened. Mercer made us afraid of doing the right thing. Aaron's eyes stayed calm. Fear does not end. You just decide what you do while it is there. Caleb nodded, swallowing hard, then moved on. 2 days passed with Aaron sleeping in short bursts on a stiff chair outside the secure ward. She refused the hotel room offered by a staff officer. She drank coffee that tasted like burnt paper. She watched guards change shifts. She listened to distant footsteps and the occasional murmur of radios. She felt the weight of being in a place where decisions had consequences that reached beyond one patient. On the second night, an officer approached her, posture formal. Ma'am, he said, General Vale is awake and requests you. Aaron stood joints protesting, then followed him into the ward. Vale lay propped, slightly oxygen cannula in place, skin no longer gray, but still pale. His eyes were clear. The room smelled like clean linen and antiseptic, and it felt strange to see him in a bed that was not surrounded by chaos. When Aaron stepped close, Vale's gaze held hers. You look like hell, he said, voice raspy. Aaron answered without missing a beat. You look worse. A faint smile touched his mouth, then faded into seriousness. They told me what happened at Rainier after we left. Aaron did not respond. She waited. Vale's eyes narrowed. The cleaners were not freelance. The handler we caught has ties to defense procurement, shell companies, donor pipelines. They used Rainier as a laundering node and Mercer as a delivery mechanism. Aaron's throat tightened, and Mercer. Vale's gaze went distant for a moment. Mercer believed he was untouchable. He believed money was armor. He was wrong. Aaron looked at the monitor, then back at Vale. You asked for Rainier. You walked into it. Vale's voice stayed low. We needed proof. We needed the chain. They would never expose themselves for a routine investigation. They exposed themselves for a certainty. For my death. Aaron felt cold travel up her spine. You were bait. Vale's eyes held hers without apology. Yes. Aaron's jaw tightened. And you were willing to die. Vale's voice was quiet. I was willing to risk it. I did not plan to die. That is why I demanded you. Aaron stared at him. Her anger flared briefly, then burned out into exhaustion. You could have told me. Vale's expression did not soften, but something like respect flickered. If I told you, you would have refused. Aaron did not deny it. Vale shifted slightly, wincing. They restored your license. Aaron froze. What? Vale watched her face carefully. Your record was cleared, pending formal review. The complaint filed against you was found to be retaliatory. The lock policy Mercer implemented violated emergency care standards. The board at Rainier is being dissolved. Interim management is being appointed under federal oversight. Aaron's chest tightened in a way that did not feel like relief, so much as the sudden return of oxygen to a part of her that had been starved. She spoke quietly. You did that. Vale's eyes stayed steady. Truth did it. My signature helped it move. Aaron looked down at her hands, still stained faintly at the cuticles from bleach that never fully washed out. I do not even know how to go back to being normal. Vale's voice was calm. Do not go back. Aaron lifted her gaze. What does that mean? Vale's eyes held a grim humor. It means I have a problem. Aaron waited. Vale continued. Special operations medicine is full of people who follow protocol until it breaks. Then they freeze. I need someone who does not freeze. Aaron's throat tightened. I'm not military. Vale's mouth twitched. You do not need to be. You already did the work in places most people do not survive. Aaron stayed silent, hearing the rotor roar in her memory, hearing gunfire in a boiler room, feeling Dorsey's weight on her shoulder in the tunnels. Vale watched her. Think about it. Do not answer now. Aaron nodded once, not agreeing, not refusing, simply acknowledging the offer existed. When she left the ward, she passed a hallway television showing a brief news segment with no names. A disruption at Rainier. A security incident. Federal investigation. The reporter used careful language, and behind the careful language was a sense of something large shifting. The next week moved in meetings and signatures. Aaron sat in a hearing room where her name was read aloud, and no one said it like an accusation. An official from the Nursing Commission spoke in formal tones about emergency doctrine and retaliatory reporting. Aaron answered questions with the same calm she used in trauma bays. Linda testified, Caleb testified. Even Brittany testified, voice shaking, admitting she had followed Mercer's orders because she was afraid. The commission chair looked at Aaron at the end and said, "Your license remains in good standing." Aaron nodded once as if receiving lab results. After the hearing, Aaron went back to Paws and Pints to return the name tag. The receptionist looked up surprised. "You okay?" Aaron placed the tag gently on the counter. "I am leaving." The receptionist's face softened. Somebody finally realized what they had. Aaron did not answer. She glanced down the hallway where kennels lined the walls, dogs barking, cats hissing. She had saved lives here too, in a place that never asked for her history. She felt gratitude, quiet and real. The young vet stepped out from the treatment room and saw the military sedan idling outside. He raised an eyebrow. "Looks like you are getting recruited." Aaron's mouth twitched, something like that. 3 months later, the ballroom in downtown Seattle shimmered with polished uniforms and camera flashes. The event had the clean feel of ceremony, but the security presence around the perimeter reminded Aaron that nothing about the last months had been ordinary. Aaron stood near the back for a moment, letting her eyes take in the scene. The ceilings were high chandeliers, bright. The air smelled like perfume and expensive food. A military band played softly. Officers moved in clusters, laughter controlled, smiles measured. She wore a deep blue dress that made her feel slightly unfamiliar to herself. She had left her hair down, not because she forgot how to tie it back, but because for once she could. Linda stood beside her, also, in a dress looking proud and nervous at the same time. "You look," Linda started, then stopped searching for the right word. "Out of place," Aaron finished. Linda smiled faintly. "Like you belong, and you do not want to admit it." Aaron exhaled softly. "I would rather be in scrubs." Linda's eyes flicked toward the head table. "He is here." Mason Vale sat at the front in dress uniform, thinner but alive. The gray pallor was gone. His posture was still military, even in a chair, shoulders squared, gaze scanning the room with the same alertness he carried in war zones. Dorsey sat near him, arm in a sling expression, unchanged, a man who looked like he could intimidate a room by blinking. An official stepped to the podium, and the murmur in the ballroom faded into attentive silence. The speech was formal, but the words carried weight. Corruption, trust, lives lost and lives saved. The official did not sensationalize the violence. He named what mattered without turning it into a spectacle. Then his gaze moved to the audience. "Aaron McCall," he said, "please step forward." The room erupted into applause that started cautious, then grew louder as people recognized the story, even if they did not know all the details. Aaron felt her chest tighten, and she forced herself to keep walking. She reached the stage and faced the audience. Cameras flashed. Aaron did not flinch. She had faced worse lights. The official pinned a medal to her dress, a civilian honor for valor. The ribbon felt heavier than it should have, as if it carried the night she had spent scrubbing kennel floors, the humiliation of being escorted out of Rainier, the cold concrete of the steam tunnels. When he handed her the microphone, Erin held it with steady hands. She looked out at the crowd, at the uniforms, at the faces that had never sat in Trauma Bay 4 with a teenager turning blue. "I am not here because I wanted an award," she said, voice clear. "I am here because someone was dying and there was work to do." A small ripple of laughter moved through the room, not amusement recognition. Erin continued, eyes steady. "Titles do not stop bleeding. Paperwork does not open an airway. Hands do. Minds do. People do." She paused, letting the silence settle. "If you are the person standing closest to the patient, then you are responsible for that moment," she said. "That is all." She stepped back from the microphone and the applause rose again, loud enough to make her throat tighten. Later on, the balcony outside the ballroom, Seattle's lights stretched across wet streets. The air was cold, and the sound of the city felt distant compared to the hum inside. Erin stood alone for a moment, holding a glass of water she had not touched. She watched her breath turn faint in the air. Mason Vale stepped onto the balcony without ceremony. He moved slower than before, but with controlled strength. He leaned on the railing beside her and looked out at the city as if studying terrain. "You gave them the truth without dressing it up," he said. Erin's eyes stayed on the lights. "I did not have the energy to dress it up." Vale's mouth twitched. "Fair." They stood in silence for a beat. Then Vale reached into his jacket and pulled out an envelope. Plain. Official. He held it out. Erin did not take it immediately. "The hospital offered you a position," Vale said. "Head nurse. Double salary. Full benefits. Public apology." Erin's jaw tightened. "I received the letter." Vale nodded once. Erin looked out at the rain shining on the streets below. "Rainier smells like broken glass to me." Vale held the envelope steady. "Then do not go back." Erin finally took it, fingers brushing the paper. She opened it and read, "Department of Defense letterhead. Special Operations Command. Chief Medical Advisor role. Consultant status." A signature line already prepared. Erin's throat tightened in surprise that felt like fear, because fear often arrived wearing new clothes. "I am a civilian," she said. Vale's voice was quiet. "We made an exception." Erin looked up. "Why?" Vale's eyes held hers unflinching. "Because I do not want people around me who are afraid to tell me no. Because I do not want someone saving my life who freezes when the rules fail. Because I watched you carry a wounded man through a tunnel while bullets hunted you and you did not quit." Erin stared at the paper again. The words were clean and official. The path it offered was not. She let out a slow breath. "You know I will be difficult." Vale's mouth curved into a faint, wolfish grin. "I am counting on it." Erin pulled a pen from her clutch, a simple thing that suddenly felt like a weapon, and signed on the railing with the city lights below. Vale took the paper back carefully, as if it mattered more than a contract. He tucked it inside his jacket over his heart. Erin looked at him. "You are still recovering." Vale nodded. "Yes." Erin's voice softened slightly. "Then you follow my orders for once." Vale's eyes held hers. "Yes, ma'am." Inside, the band played again. The ballroom noise drifted through the open door in waves. Erin stood on the balcony with cold air on her face and the metal heavy on her chest, and for the first time in a long time, she felt her life moving forward without needing to apologize for it.